case, the 10 years might be appropriate. This is just to show you what the cancer looks like in the surgical specimen. You can see the abnormal reddish tissue in the lower part. I'll take your question in just a minute. I want to just get a little more detail on the options for screening. So I mentioned you can do stool blood tests. Stool blood tests were one of the earliest examinations done because they were least expensive. They were widely available in all doctors' offices. You would submit a small specimen onto a card. You would submit 3 cards, either of 3 consecutive bowel movements or 3 days. The doctor would put a small amount of a chemical on, and it would detect traces of occult or hidden blood that you cannot see. The limit of this test is you have to do 3 specimens. You have to be on a special diet. You have to avoid taking certain foods which can give false positives. And you have to avoid certain things which can give false negatives. That can, you may be having some blood loss and it'll obscure the result. On top of that, it has to be done every year to be effective. There's a new stool test that has been approved by the FDA called the fecal immunochemical test. This is based on the technique of monoclonal antibodies. Again, a small specimen is obtained by wiping a tiny brush along